Welcome to the HealthLinks Podcast, presented by the HealthLinks family of services. I'm your host, DJ Thatcher. Our mission here is to engage in conversations about the medical and wellness landscape of South Carolina so we're all better informed. In this episode, we're at the Lowcountry Orthopaedics and Sports Medicine Center, joined by Dr. Keith Santiago, a board-certified orthopedic surgeon and hand surgeon. Dr. Santiago, welcome to the HealthLinks Podcast.
Thank you for having me.
So, Dr. Santiago, many people are familiar with orthopedic surgeons. They may not realize that there are so many specialties like spine and pain management, foot and ankle, and hand surgery as well. So tell us, as you meet someone on the street and they ask you that question, what do you do? How do you answer that?
Yeah, I say I'm an orthopedic surgeon. When they get into specifics, I say I specialize in the hand and upper extremity. Nowadays with orthopedics, with the complexity of injuries that we see, there are multiple specialties. There are specialties for back and spine. There's also specialties for sports medicine doctors. There's also specialties for hand and upper extremity, which is what I do.
Terrific. So what are some of the most common conditions you see? And I'm curious if it's more injury or trauma related, or if it's more medical types of illnesses and so forth.
It's a little bit of both. I see my fair share of trauma as an orthopedic surgeon. I see the bumps, the bruises, the falls, the sprains, the strains, the fractures, which is kind of basic to what we do. But also see patients that come in with sometimes more chronic issues of pain in their hands and wrists, difficulty with opening up jars, turning door handles, pinching. Sometimes they get numbness and tingling in their fingers, which is related to a neurological condition often. So I see all sorts of different issues in patients from all different ages as well, from children to adults.
So it's a real quality of life issue with many of those conditions.
It can be.
I forget from my days of anatomy how many bones there are in the hand, but it's a very obviously very complicated structure. I forget how many there are. It's an amazing number.
And that's right. That's why you have somebody like myself that specializes just in the hand and upper extremity because of the complexity just of that region itself. And so oftentimes when you're seeing a surgeon, you want somebody that focuses on a specific area that does a high volume or a large number of cases, not only from a surgical standpoint, from a procedural standpoint, but also somebody who has seen a lot and it can kind of recognize some typical cases, also some atypical cases.
You mentioned you're both specializing both in the hand and the upper extremity, because obviously they're all connected. Tell us a bit about the education that goes into that, though, post-medical school and residency and so forth.
So that's a great question. So after high school, I spent 4 years in college. I went to Harvard University in Cambridge, Massachusetts. I then did a 4-year medical school training in Detroit, Michigan. And then I spent 5 years at Northwestern University in Chicago, Illinois, where I trained to become an orthopedic surgeon. I then spent another additional year learning the hand and upper extremity at the University of Pittsburgh. And then I came into practice here at Lowcountry Orthopaedics in 2010.
Terrific. What brought you to the Lowcountry, by the way?
So I have a great story for that. I grew up in Detroit, Michigan, where I'm from. My wife is from the Boston, Massachusetts area, but her family had moved down to the Myrtle Beach, South Carolina area. And when I got married in 2009, the advice I got, in order for me to be happy, I have to keep my wife happy. So here we are as Southerners, and I was able to find a job here in Charleston, South Carolina. We've been very happy being here since 2010 with 2 children that we enjoy and love.
It's a great place. We're fortunate to have you here.
Thank you.
So what are some of the more challenging types of cases that you deal with?
Yeah, certainly cases that are trauma-related. They can be complicated because sometimes they don't follow an exact textbook type of pattern. But I rely on my skills and my training to identify common patterns and use kind of principles that I've learned and kind of stick with those principles to solve complex problems.
Sure. We're thinking about, from the standpoint of injuries coming from an emergency background, we see a lot of typical boxers' fractures and that sort of thing. We're familiar with carpal tunnel syndrome and maybe trigger finger and that sort of thing. What else do you see, though, as far as the complicated cases? Maybe it's just crush injuries or other things like that?
It's a great question. You mentioned about your emergency medicine background. And so while the common boxer fracture is something I commonly see, the kind of more unique case I get here in South Carolina, which I didn't even get very much in training, were individuals that have been bitten by a crocodile. An example, firework injuries. Those are pretty intense. Another kind of common case I get, which can be very complicated, are table saws. Table saws, unfortunately, do a lot of destruction to the hand and fingers, and a very common, unfortunately, work-related injury that I see.
Walk us through some of the treatments for injuries in this case. We'll stick with that theme for a minute. Many of us are familiar with the larger bones. You might pin them and so forth. But what about these delicate bones of the hand? How do you treat those?
Yeah, so the first concern is to evaluate for the viability of the digit or of the hand itself to make sure that there's adequate blood supply. You need blood supply to promote healing, and so that has to be established first. Once that's established, the next question is for infection. Infection can be pretty dramatic, and so you want to make sure that you take steps to prevent infection. And that's when sometimes one needs more than just antibiotics given by mouth or by IV, and they have to be taken to the operating room to get their wound cleaned out. The next question is to stabilize the bony structure itself. The bones essentially acts as a foundation for the limb itself, and so the first goal is to establish that foundation, to stabilize the bony structure, of which then you can build the parts around that bone itself, whether it be the tendon, the tissue, or the skin, the nerves, the blood vessels, and the tendons.
Okay.
So again, using these basic principles of making sure the foundation is stabilized and then building the structures around the foundation is the basic principle that I use in these complicated trauma cases and some of the things I've mentioned to you already.
That might be one of the aspects that people don't appreciate is the fact that they might think an orthopedic surgeon deals only with a bone, but you're dealing with blood vessels and nerves and everything else as well. True.
That's very true. And that's one of the beauties that drew me to hand surgery itself is my ability to address all those issues because all those structures are very intimately associated with each other in the hand and upper extremity.
I was going to ask you that later, but I'll ask you now. You know, obviously well-educated, Harvard and Wayne State, Northwestern University of Pittsburgh, etc. Of all of the things that you could have done with your professional life, what drew you to hand surgery?
Yeah, I think it was the attention to detail, as I've illustrated already, the ability to treat both children to adults. When I first went to medicine, I had a focus on treating children. I was also drawn to the emergency medicine aspect of things because I found great satisfaction in addressing somebody in their time of greatest need, which sometimes can be an emergency itself.
Sure.
And so I was drawn to orthopedics and their ability to provide help for patients and be a drastic influence in improving their health and well-being in their livelihood.
Terrific. Switching gears now to the medical problems that you had mentioned. People have trouble just with everyday things, turning doorknobs or having numbness or tingling. Many people might attribute that just to aging, but what might be the underlying condition going on there?
Well, it all depends on getting an adequate history from the patient themselves. That's why I try to take my time in terms of sitting down, asking patients open-ended questions, because oftentimes the patient, even before I examine them, can lead me to a diagnosis, in which I then confirm by my examination. But I take into their history what could be the causing factor for their condition, whether it truly is aging, which is certainly the case sometimes, but it also could be other things in terms of how they're positioning their body when they're doing certain activities, maybe how they sleep. I tell patients that oftentimes come and see me with something like carpal tunnel syndrome. Oftentimes it's maybe related to how they sleep. A lot of people tend to clench their fingers, bend their wrists when they sleep at night, which can cut off sometimes the blood and circulation to their hands and wrists.
Right.
And I'm glad you brought that up. I take pride in not necessarily offering patients surgery as the first option because that may not be the most appropriate thing. One of the beauties of being a surgeon is that not only can I offer them non-operative treatment, such as braces, anti-inflammatory medications or medication in general, therapy, injections. I can try to do non-operative things to help avoid surgery and leave surgery as last option. Again, whatever's appropriate given their situation. And sometimes I'll make a comment to patients that sometimes God, to be frank with you, is a better surgeon than me.
Right. Yeah, you got a full staff here. Tell us about some of the people on your staff who do some of those other treatments,
Yes, so
physical therapists and so forth.
That's a great question. One of the things that I enjoy about my practice is that I work as a team. I not only have a team in terms of my phone operators and my front desk that greet patients and I get them on my schedule, but I also have a medical assistant that helps me, along with my physician assistant, that helps me evaluate patients. But I also have a team of providers. Complications from scar tissue or from stiffness. We also have our own surgery center where we can provide patient surgery at a lower cost than maybe at the hospital itself. We also have our own MRI machine for diagnostic purposes. So we have a good multimodal practice to provide solutions for patients, whatever their need may be.
Sure. Tell us more about the surgery center and what you can do there versus going to one of the hospitals.
So at the surgery center, we can provide patients. We have a teamwork of providers that evaluate the patient even before they come in so that we can get appropriate testing, even before they get to our facility so they can have the surgery done safely. The surgery center provides a clean environment. You come in and leave in an appropriate and timely fashion.
Nice. Very nice. So what's on the forefront of orthopedic surgery in general and hand and upper extremity surgery in particular? What are you excited about on the forefront?
I'm excited about is novel diagnostic testing that's available, and also treatment as well.
What's that all about? You say novel diagnostic testing. What's that all about?
So diagnostic testing using other modalities such as ultrasound, using different forms of MRI or other testing to figure out a diagnosis. Even from a surgical standpoint, we're using equipment such as an arthroscope, which is basically a tool to get into a patient's joint less invasively, to look at their cartilage, look at the ligaments, look at their structure of their joint without having to make a large open incision.
Interesting. Have robotics or AI, artificial intelligence, entered into your specialty yet, or is that on the forefront?
That's a good question. That's being brought into the specialty itself in terms of robotics. Some of my partners perform robotic joint replacement surgery, such as for the hip and knee. For the hand upper extremity, it hasn't quite entered our field yet, but that's certainly something that people are trying to pioneer, and it's on the horizon.
Sure. So our listeners and our viewers who are out there and they're thinking, I have some issues with pain or numbness or that sort of thing. What are some warning signs that people should be watching for that it might, instead of just chalking it up to aging or something else, that might lend them to want to give you a call?
Yeah, so pain that persists is concerning. Obviously, if the pain occurs once and rapidly disappears without maybe any intervention, is probably nothing too significant to worry about. But if the pain persists or worsens over time, those are things to be concerned about. Symptoms that affect their joy and their happiness, that's a concern, because those are things that may be treatable and maybe even preventable.
So what are some of the medical causes of hand-related issues that you see? We're familiar with carpal tunnel, like I say, trigger finger release and that sort of thing. What are some of the others? There's a whole list. Great website, by the way. Check it out. But a whole list of conditions there. What are some of the ones you see?
Yeah, I see lumps and bumps, either be tumors or what they call ganglion cysts. We see a lot of tendon issues, such as tendon issues at the wrist, tendon issues at the elbow themselves, with people that tend to play sports like golfing or tennis. We see issues related to nerve problems even at the elbow itself. Sometimes there can be sprains, strains, or even fractures of their hands, wrists, forearm, and elbow.
Interesting. Now, we've had the hand waving at everyone the whole time we've been here. Maybe walk us through that, some of the other devices that you have here that you're using for diagnosing and recommendations.
Absolutely. I think this hand model does a great job at showing some of the complexity of the hand itself. As you can see with the structures in red, here are the blood vessels. Hand has multiple layers and multiple bones, as was mentioned earlier. You have a tissue called the fascia that kind of covers up some of your important structures, and that fascia and a ligament can kind of tighten over time at the level of the wrists. And at this level right here, it can pinch on this nerve right here, this yellow nerve right here called your median nerve, causing the condition called carpal tunnel syndrome, like we alluded to before. And that can be very debilitating for patients, causing them to have tingling, numbness, pain, and finally muscle loss. And they notice sometimes that they're dropping things, including their silverware, china, or even sometimes even other important things that they have at home.
I know with my own patients in the past, they're often reluctant to get treatment because they don't want to go through the recovery or the lack of use and so forth. What's a typical recovery time for maybe carpal tunnel or some of the other issues that you're seeing?
Yeah, so the beauty of rehabilitation for surgery like carpal tunnel syndrome or even trigger fingers is that after the surgery, my protocol is just to put patients in a soft, bulky dressing just to cover up the wound itself. And my only restriction to them, you just don't get that wound infected, but do use and move it so it doesn't get stiff.
Oh, good.
Because from a structural standpoint, they can't do anything to cause damage or harm to the surgery I've done other than getting it infected.
Just well, before we do that, let's see some of the other equipment that you have here. I know we were playing with this before we came in the room here. The grip strength meter. Not sure how well I did, but that really is diagnostic for what?
Yeah, so I use this grip meter to kind of get a baseline sense of a patient's strength, one side to the other side, the right side versus the left side. Usually the right side or the hand dominant side is usually stronger than the other side. Also compared over time, it gives me a sense of whether the patient's progressing or becoming weaker, and it gives me some objective information numbers to work with.
Yeah, I'm just thinking, a lot of us exercise every day, but we may not do specific hand exercises. I'm just thinking this would be a great type of exercise. Are there specific exercises you recommend just for the lay public? Anyone?
Yeah, for the lay public to kind of work on your grip strength, include things like working with putty or dough and kind of kneading the putty or dough. Oftentimes I refer to patients to some of the tools you can get from like a sporting goods store that has kind of like a V-like structure they can use for hand grip to kind of improve that a little bit. Sometimes we'll give patients out a squeezy ball or a stress ball to kind of work on that to kind of build up their strength and dexterity in their hand.
From a prevention standpoint, you mentioned earlier about how we sleep and maybe how we have our hand either twisted or maybe do a fist. Anything else that maybe we're doing on a regular basis that might be affecting our hand or our upper extremity that you can think of?
Yeah, like I mentioned about carpal tunnel syndrome with patients kind of bending their wrists. Sometimes when they sleep, they also tend to bend their elbows at night, which can kind of pinch another nerve called the ulnar nerve at the elbow, which can cause a condition called cubital tunnel syndrome.
Like that.
So sometimes people will wake up with their small and ring finger asleep. So kind of, again, with a positional standpoint, if you keep your elbow in a bent position, that can sometimes cause those symptoms. We often offer patients a brace to be worn at night that keeps their elbow straight.
And for lack of a brace, just for general purposes, how should we sleep? Should we consider anything special? I'm just thinking about that now. I sleep with my heart like that.
Yeah, well, you don't need to adjust your sleep unless you're actually having symptoms.
Right,
if you're having symptoms, then those are the kind of things to consider. Either, keeping your wrists in a straight position and not keeping it flexed, and not keeping your elbows flexed. But oftentimes kind of focusing on that doesn't allow patients to sleep either. So it's something to balance. And what's nice about a brace is that you can kind of shut off the thinking and just fall asleep and let the brace do its job.
Sure. Yeah, interesting story you told me about your name. Obviously, Dr. Keith Santiago. I guess a lot of people assume that Santiago is Latin American or Spanish, but tell us about the story you told me about the derivation of for your background.
Yeah, very good. So I'll have patients come in and ask me a little bit about my last name, and my last name is Portuguese, Santiago. I was born and raised in Detroit itself, but my parents come from an area of India, of all places, an area of India called Goa, which is a former Portuguese colony settled by Vasco da Gama that you learn about in your history books in the 1400s when they sailed around the Cape of Good Hope of Africa, landing in India looking for spices and jewels. They settled in this one area called Goa, GOA, a very popular European vacation destination, where they converted the local Indian people to Catholicism and changed the last names to Portuguese last names like Santiago, Menezes, de Souza, etc.
Interesting.
Yeah.
So, well,
I'm a little reminiscent of what happened in the 1400s.
A history and cultural lesson here as well. So
there you go.
You tell us a bit about the whole practice here, Lowcountry Orthopaedics and Sports Medicine. We are at the North Charleston office. You have other offices as well. Of course, the surgery center. Give us a glimpse of everything that you do here at the practice.
Yeah, so we have multiple providers that specialize in different specialties. We believe in a team approach, and so if a patient comes in with a knee issue, I refer them to either one of my sports partners or one of my joints partners to be taken care of. so they can get concurrent treatment not only for their hand and upper extremity, but also for their knee as well. We also have partners that specialize in the spine and back, either from a pain management standpoint, from a surgical standpoint.
Okay, well, Dr. Keith Santiago, thank you so much for joining us here on the HealthLinks Podcast.
You're welcome. Thank you for having me.